Today I am reading from the book Spirit of Homeopathy, book written by Dr. Rajan Sankaran, Mind section, chapter number 31, The Heart of Case Taking. Case taking involves an application of principles of homeopathy. Our firm grasp of the principle alone can guide us in proper case taking. My purpose here is to explain some of the principles and show how in case taking we should be guided by them. The under label, the purpose and the method. In aphorism 83 of the organon reads, the individualization's examination of case of the disease demand of the healing artist nothing but freedom from prejudice and sound senses, attention in observing and faithfulness in tracing the picture of the disease. See the beauty of this aphorism. In a single aphorism, Hahnemann has given the purpose, requisite, and method of case taking. He has shown us where to go, how to reach there, and what we need to take with us. The purpose of case taking is tracing the picture of the disease. The idea is not to try and feed the patient into some remedy or the idea, but to trace out the true picture of the disease. The way to do so, this is to bring out the individuality of the patient. In this aphorism, Hahnemann is stating the cardinal principle of the homeopathy, which is that of disease is an individual affection and that each patient is an individual suffering from his own unique disease. When we want to draw someone's picture, we first note his individualizing features and similarly tracing the picture of the disease require us to bring out the individualization feature of the case. Only when you bring out the individuality of the patient can you really claim to have taken the case. Now we have both the aim of case taking, which is to trace the picture of the disease, and the method of case taking, which is to individualize the patient. What are the requirements for the case taking? The only requirement are an unprejudiced mind, an observing mind, and mind that draws a very accurate picture. We must not fit people into the slot. Instead, we have to just let the picture come out without imposing our own idea on what we see. We must try to bring out and understand the true feeling of the patient, not in terms of remedy, but in terms of human understanding. There are two ways we can take the case. The first is to try our various remedies, like a salesman trying to fit shirts on a customer. I have heard of the homeopathy who use this method of interview. For example, in the dysentery, he knows 3 remedies are there: the Ipecac, colchicum, and mercurius. To a patient with a dysentery, he would ask, "Do you have nausea with clean tongue and thirstlessness?" If the patient said yes, and he would get Ipecac. If he said no, he would ask, "Then do you have any nausea and smell of food?" So a patient said no. Does your urging persist even after the stool? And he said no. Then homeopathy has no medicine for you. This kind of fitting of our limited knowledge of materia medica onto a patient is very deleterious practice, and alternatively we can take all the relevant symptoms of the patient carefully and then look into the repertory and materia medica for suitable remedy. This method is much safer and smoother. When the great homeopath Dr. Pierce Smith was asked by the patient if he had treated similar cases before, he remarked, "I hope not." He meant that each case has to be considered individually, unprejudiced by similar case we might have seen earlier. Case taking is the process of perceiving and recording the inner expression of the patient. It is not merely the writing down and whatever the patient says. This does not mean that we have to theorize or symbolize what we see, but just trace the picture as we see it. There is a story that once there was a robbery in the house of the greater master Picasso. The police said to him, "Master Picasso, you have seen the thieves and you are one of the greatest artists of the world. Why don't you paint a picture of these thieves so that we can easily apprehend them?" Picasso complied, and on the basis of these sketches, they arrested a horse and umbrella and television set. We should not be Picasso and theorizing or symbolize, but let the picture emerge as it is, so that the correct remedy can be apprehended. What is to be cured in disease? In aphorism 3 of the organon begins with, if the physicians clearly perceive what is to be cured in disease, before we talk about how case is to be taken, we have to very clear exactly what is that we are looking for. We have said that we have to trace the picture of the disease. What exactly does disease comprise of? One of the easiest way to find this out is to study our drug proving. After all, drug effect are nothing but the artificial disease. So when we study our drug proving, we get the good idea about the disease. If we study, for example, the proving of the brainia, we find that in different provers, different organs are affected, but most provers have great aggravation from the slightest motion. Similarly, in the proving of aconitum, no matter how the prover is or no matter which of his organ are involved, there is a very prominent fear of death. General modalities and specific mental state seems to be common to most of the prover of the particular remedy. This common mental and general state produced by the remedy can be called its central disturbance. Now, each remedy produces a specific central disturbance. Under this label, every remedy produces a specific central disturbance, though different prover will have different organ involvement depending upon their susceptibility. The central disturbance supports or cause the three peripheral organ effect. The central disturbance like a stick which is constant but on which different creepers grow depending on where is situated. The stick is responsible for the growth of the creeper, but the same creeper can grow on different stick. In the same way, the central disturbance is responsible for organ pathology, but the same organ pathology can occur under different central disturbances. For example, diabetes with its common symptom can occur under so many remedies that it almost seems to be like a creeper which can loop on to the any stick. Our job is not to cut the creeper but to remove the stick that support them. If you cut only the creeper and leave the stick intact, some other creeper can grow on that stick. Under label central disturbance is PNEI disturbance. The central disturbance is produced by the remedy consists of those features or remedy that are constant no matter who the prover is. These features are identified as mental symptom and functional symptom of the nervous, endocrine and immunological system. Together they form an axis and one axis which we can call as the psychoneuroendocrine immunological system, PNEI system. These PNEI systems of the remedy remain more or less constant in different provers, but the organ involvement keeps varying, and so one can say that the organ involvement comes secondary to the central disturbance, just as the stick comes first and the creeper grow on it later. Remedy produce artificial diseases. We have seen how in such a disease the central disturbance comes first and the peripheral pathology come later. Similarly, in the natural disease, there is a central disturbance which support all the peripheral pathology. It is this central disturbance that has to be treated, and it is this central disturbance that has to be matched the central disturbance of the remedy. In practice, we find patients whose central disturbance indicate the same remedy but they have different pathology. In homeopathy, when we talk the diagnosis of disease, we do not talk in terms of whether a person has diabetes or schizophrenia, but we say a person now has a Kali carbonicum state or the sepia state. What may be common for all the cases having the Kali carbonicum state is that their mental and general symptom will be like a Kali carbonicum. These represent the central disturbance of the patient and they give a clue to his individuality. Now on the label, local peculiarity also indicate the central disturbance. Even though pathology depends on the individual susceptibility, the peculiarity of the local symptom depends on the nature of the central disturbance. Just as the nature of the creeper does not depend on the stick that support it, but the way it takes shape depends on the shape of a stick. So we say the characteristic of the particular symptom are also an expression of the central disturbance along with the mental and general symptoms. Thus, local symptoms can help us only if we discriminate between what is common to the pathology from what is peculiar. That which is peculiar is an expression of the central disturbance. For example, in a case of peptic ulcer, the patient gets pain when hungry. This is common to ulcer patients. But if we say the pain is relieved by rapid movement, this feature is not in the nature of the ulcer. So it must represent the central disturbance. Now under label, discovering the central disturbance of the case. In case taking, our job is to find out the central disturbance which is often hidden by the feature of peripheral pathology. It is likely identifying the stick which is hidden by the creeper. We can easily understand that as time passes, more creeper get added. The sticks get further hidden from the view and recognize it become more and more difficult. In an acute cases or one of the recent origin or in the case of a child, the central disturbance is less obscured from view and symptoms are spontaneously forthcoming without much effort on the part of the physician. In the chronic cases where much time has elapsed, the central disturbance is more obscure and the physician has to make a conscious effort to determine the original symptom. Two factors contribute to obscure the central disturbance. Symptoms of the situation of the patient, symptom of the pathology. Hahnemann used the word striking symptom to indicate the symptom that immediately catch our attention. Naturally, these symptoms have to stand out against the background of the patient's situation. Now under label, mental state has to be judged against the situation. Aphorism 211 of the organ reads, the state of disposition of the patient often chiefly determines the selection of the homeopathic remedy as being a decided characteristic symptom which can list all of remain concealed from the accurately observing physician. Hahnemann asserts that of all the characteristics of the patient, his mental state is easiest to elicit. What could make the process difficult is that often some part of the mental state is due to the situation itself. Each patient has to be judged keeping his situation in mind. It is only then that one can see what is individual to him.